Another day, another story. Guillain-Barré Syndrome, GBS, is a rare neurological disorder in which the body's immune system mistakenly attacks the peripheral nervous system, the network of nerves outside the brain and spinal cord. This can cause muscle weakness, numbness, and sometimes paralysis. Here's an overview of the condition. Welcome to Tabo Eminent Channel. Symptoms: weakness or tingling in the legs, which often spreads to the arms and upper body. Difficulty walking, climbing stairs, or performing daily tasks. Severe cases can lead to complete paralysis. In some cases, it can affect the muscles involved in breathing, leading to respiratory failure. Causes: autoimmune reaction. GBS occurs when the immune system attacks the myelin sheath, the protective covering of nerves, or the nerves themselves, disrupting nerve signals. It often follows an infection, e.g., respiratory or gastrointestinal, surgery, or vaccination. Common triggers include diagnosis, physical exam, check for muscle strength, reflexes, and sensory function. Lumbar puncture, test cerebrospinal fluid for elevated protein levels. Nerve conduction studies, measure how well nerves transmit signals. Electromyography, EMG, tests muscle activity. Treatment: plasmapheresis, plasma exchange, removes harmful antibodies from the blood. Intravenous immunoglobulin, IVIG, provides healthy antibodies to neutralize the harmful ones. Supportive care, such as mechanical ventilation for respiratory failure, is crucial in severe cases. Physical therapy helps with recovery. Prognosis: most people recover fully or nearly fully, but recovery can take weeks to months. Some individuals may experience long-term effects like weakness or fatigue. Rarely, GBS can be fatal, particularly if it affects the respiratory system or autonomic functions, like heart rate or blood pressure. Notable cases and public health importance: GBS has been linked to certain outbreaks, e.g., Zika virus, and occasionally to vaccines, though this is rare and benefits often outweigh risks. Early treatment is critical for improving outcomes. Imagine a healthy individual, perhaps a 30-year-old teacher, living an active, fulfilling life. One day, after recovering from what seemed like a mild stomach bug, they notice tingling sensations in their feet. At first, they brush it off, thinking it might just be poor circulation or fatigue from standing all day. However, within a few days, the tingling spreads to their legs and hands, accompanied by weakness. Walking becomes difficult, and they struggle to hold objects. Alarmed, they visit a doctor. Diagnosis and discovery: at the hospital, the neurologist suspects Guillain-Barré Syndrome, GBS, based on the rapidly progressing symptoms. After a lumbar puncture reveals high protein levels in the cerebrospinal fluid and nerve conduction studies confirm slowed signals, the diagnosis is clear. The patient learns that their immune system has turned against their own body, attacking the nerves that control movement and sensation. The doctor explains that the cause may have been a recent infection, likely the stomach bug caused by Campylobacter jejuni, a common bacterial trigger for GBS. They also reassure the patient that, although the condition is serious, treatments are available. The battle with GBS: the next phase is daunting. The weakness worsens, and soon the teacher can barely stand. Breathing becomes labored as the syndrome affects the muscles of the chest. They are moved to the intensive care unit, ICU, and placed on a ventilator to support their breathing. Fear and uncertainty set in, not just for the patient, but for their family and friends. Treatment begins with plasmapheresis, plasma exchange, where the harmful antibodies attacking the nerves are removed from the blood. Alongside this, intravenous immunoglobulin, IVIG, is administered, flooding their system with healthy antibodies to halt the immune attack. A long road to recovery: GBS doesn't progress forever. After reaching its peak, usually within 2-4 weeks, the recovery phase begins. For the teacher, recovery is slow. Months of physical therapy are needed to regain strength and relearn basic movements like walking. There are moments of frustration, but also triumph when they take their first steps without assistance. Although they eventually return to the classroom, they are left with lingering fatigue and occasional muscle weakness, a reminder of their battle with this rare condition. Larger implications stories like this highlight the unpredictable nature of GBS. It can strike anyone, regardless of age or health. While rare, it often makes headlines during outbreaks of certain infections like, governments and health agencies monitor GBS closely, particularly during vaccination campaigns or outbreaks of infectious diseases. Although some people associate it with vaccines, the risk of developing GBS after an infection like the flu or COVID-19 is far greater than the risk associated with vaccination. The takeaway: Guillain-Barré Syndrome is a reminder of the body's complexity and its vulnerabilities. For those who experience it, the journey is a testament to resilience. And for the medical community, it underscores the importance of rapid diagnosis, supportive care, and ongoing research into autoimmune conditions. The athlete's sudden collapse. Sophia, a 26-year-old marathon runner, was at the peak of her fitness. She had recently finished her third marathon and was preparing for an international competition. A week after recovering from a mild flu, she noticed a strange sensation in her toes, a slight tingling that felt like pins and needles. She dismissed it, thinking it was related to her intense training. However, the tingling didn't go away. Instead, it crept upward to her calves. Soon, her legs felt heavy, as if weighted down by invisible sandbags. During her morning run, she stumbled and fell. Sophia, who had always been in control of her body, was confused and scared. Hospital visit. When Sophia arrived at the hospital, she had to be wheeled in. She couldn't lift her legs, and her arms were starting to feel weak as well. The doctors ran several tests, including blood work and an MRI, but they couldn't find anything obvious at first. A neurologist was called in when Sophia mentioned that her symptoms had started in her feet and were progressing upward, a hallmark of Guillain-Barré syndrome. The neurologist ordered a lumbar puncture, which revealed elevated protein levels in her cerebrospinal fluid. A nerve conduction test confirmed that her nerves were not transmitting signals properly. The diagnosis was clear: Sophia had GBS, likely triggered by her recent flu. Rapid progression. Sophia's condition worsened over the next few days. The paralysis moved upward, eventually affecting her chest and facial muscles. She could no longer smile or speak clearly. Breathing became difficult, and she was placed on a ventilator. For someone who relied on her physical strength and independence, the situation was devastating. Her doctors reassured her that while GBS was serious, most patients recovered fully with treatment. They began plasmapheresis, a process to remove harmful antibodies from her blood, and administered intravenous immunoglobulin, IVIG, to halt the immune attack on her nerves. The emotional toll. The hardest part for Sophia wasn't the physical paralysis, it was the emotional impact. She couldn't communicate easily, and the thought of never running again loomed over her. Her family and friends rallied around her, but she often felt isolated and trapped in her own body. A physical therapist visited her daily, even when she couldn't move, gently stretching her limbs to prevent muscle atrophy. The therapist assured her that recovery was possible, but it would take time and patience.